Dr. Tom is voted by you Best Cosmetic Surgeon for 9 years, and his team has won Best Aesthetician for 3 of the last 4 years by the Press Democrat readers. Dr. Tom, I know you got to go to a party here recently to celebrate that.
We did, actually. My team got to go to a party. I was working in Maui. I know all our listeners, thank you for listening. Don't feel sorry for me. I had to work in Maui at our Maui office, but our team went and represented us very well at the Press Democrat Awards ceremony. So thank you, Michelle.
Super fun.
So that was a lot of fun. We had a great time. They had a great time. I could see on their social media posts, in fact.
Yeah, they looked great. They were all dressed in pink.
They were all dressed in pink, absolutely. And it was Wednesday, so those of you who know the movie culture, on Wednesdays they wear pink.
Right,
so there you go.
Mean Girls, I love it.
Mean Girls, exactly.
We also decided to wear pink, which you'll see on the YouTube.
We did. See that? It's Thursday, but I guess we'll pretend it's Wednesday today. Yes.
Yeah. Right on. So today I get to sit in this seat here next to you. Normally I'm right over there running the board, but today we're going to talk about SmartLipo. So for people who are not familiar with SmartLipo, Dr. Tom, can you tell us about it?
Absolutely. It's been around, I can't believe it, since 2007, Michelle. Actually, I was very fortunate to be the first surgeon in Northern California to introduce SmartLipo in 2007. In fact, we were lucky enough to be featured on San Francisco TV and so forth. So that really kind of launched our program. SmartLipo is this unique combination of actually real liposuction, or lipo, which is removing fat through little tubes, all done under local anesthesia, and then adding a laser to get a smoother result. So traditionally, liposuction was done under general anesthesia, and so there's potential risk, and they didn't use very little local anesthesia, so the results weren't as good in terms of smoothness, consistent reduction of fat throughout an area that you were treating. And with SmartLipo, the technique that was introduced from South America, and we learned that and brought that to the United States, was to do everything under local. So we use something, Michelle, called tumescent anesthesia, and that's where it's a very dilute amount of local anesthesia called lidocaine, and we can infuse it in large amounts, believe it or not, safely, in an area, so typically like in the abdomen or the muffin top area, and as we infuse that, you get this dense anesthesia, which is really cool. Yeah, it's really neat. And
is it sort of like when your foot falls asleep, right, and you can't feel it, and you can't walk on it? You can't feel it.
Except that's sort of an irritating numbness, right? I don't like that feeling. But no, the area gets completely numb.
Okay.
And then what we do is through tiny little puncture sites, we actually can then introduce a laser fiber, and we put the laser fiber underneath the skin, and by putting it under the skin, you do get a smoothing type of response. So you get a little bit of tissue tightening, excuse me, not tissue typing, but tissue tightening.
Okay.
It doesn't replace, for instance, a tummy tuck if that's what you need, or if you need a neck lift, then it's not going to replace that, but it can increase some of the tissue tightness that's there. And also because of the laser that we run just underneath the skin, what will happen is that you will get more of an emulsification of fat under there, and therefore as it coalesces, and we do suction some of that out, what you'll get is a smoother result. And because of this technique, using the laser, using the local anesthesia, we can use tinier tubes to do the suction. Okay, those tubes are called cannulas, Michelle.
Yeah.
And in the old days, it would be, think of like a big ballpoint pen and you take the cap off. They would be that big. That's a pretty big hole,
pretty
right?
Large, yeah.
And although you could more quickly remove fat, you're going to get more irregularities that way, and also more bleeding and a longer recovery for the patient. When we basically tamponade, or we just super saturate the fat tissues with this local anesthesia, we can now go in with these tiny little cannulas, which are 3 millimeters in size. So if you know the metric system, 3 millimeters
it's pretty
is
small,
really pretty small. There's 25 millimeters in an inch, so it's less than a tenth of an inch. Okay, they're very, very small. And we go in and we can suction out the fat. So it takes longer for the surgeon to do it with this technique, but it's way better, more better for the patient. They have less discomfort, less pain.
Right.
Their recovery is much quicker this way. And in my opinion, along with the addition of the laser, you get a much smoother result.
Yeah, that's
so,
great.
And we've been doing this since 2007. Have done close to 1,000 procedures, and I have to tell you that patients are much happier with this technique than with the older traditional technique of liposuction.
That's great. So I have a question
Sure.
about this, because I'm always thinking about what you're saying and trying to like picture how this
Okay.
works. You said that you actually, because of the technique, it sort of emulsifies some of the fat.
Correct.
And that can add a smoother appearance.
Correct.
Is that because the fat that is still there has been emulsified? Do you leave some of it there? I mean, like how does that
How does
work?
that happen? How do you
Yeah.
get that smooth? So some of the fat that we emulsify with the laser, and then we also have a mechanical cannula, which has a little bit rougher surface. I will, when I show the patients, because they're awake and I'm talking to them, and sometimes I'll show them what I'm doing,
Right.
is that I can take my gloved hand, and I can run it over the tip, and it doesn't do anything bad to that. But just a little bit of that roughness on the tip of the cannula can actually help to break up the fat structure. So the fat is sitting in cells, okay? Then that's fat cells contain fat, lipids, and it's in a honeycomb system,
Right.
okay, of connective tissue. So as you go through there and you're disrupting that, it frees up the cells.
Got it. Okay.
Excuse me. And so therefore, excuse my cough, and so therefore it appears liquid to the naked eye,
Okay,
not under a
okay.
microscope, even though there are viable cells there. And so with that liquefied fat, if you will, that goes from like a gel-like state in the connective tissue to being disrupted and now emulsified, it makes it easier for us to suction it out through these tinier cannulas.
Right.
But also it helps us to do what we call lipo shifting. So think about lipo or fat and then shifting. So as we do this and as we emulsify the fat and we suction it out, we can also, with the help of a compression garment, and that's really important if you're going to have this done. You know, when we make our recommendations for post-op instructions, these have been studied and we know that this is beneficial for you, the patient. Wearing the compression garment helps to lipo shift, if you will, some of this emulsified fat from areas where we don't want it to areas where we do want it. So for
Right.
instance, if you are having your abdomen done, having a tight garment in that area helps to move it away from the abdomen and the waist, where we all want a thinner waist, right? And move it maybe down lower into the hip area, higher up into the chest area.
look at that.
So that's very helpful.
Yeah.
Or if we do SmartLipo of the chin and neck area, wearing a garment like that helps to shift the fat away from there and then into areas where we might want it or where it's less noticeable.
Right. Ah, that's so interesting.
So that's called lipo shifting.
Lipo shifting.
Lipo
All right. I've
shifting,
never
right.
even heard of this before today, so I love that. That's very cool. So where are the areas that are most popular for someone to ask? You've talked about the neck and the waist and
Right.
maybe the muffin top kind of
Right.
area.
Well, those are pretty
That's
much
it?
the three, but
Yeah.
well, I'll tell you the number one area that for men and women, and we still are seeing more women than men, but we're seeing more and more men all the time. It is the abdomen, what patients call the waist, and I call the flank. So if you kind of put your hands on your hips, everybody, and then kind of bring them up to your rib cage, that's the waist area. That's the beginning of the flank, FLANK area, and then move your hands back to above your hip bone there, and that's what the kids call the muffin top,
Got
right?
it,
And
okay.
we all know that. And with my increasing age, and you put on some jeans. Notice that I've been getting away from jeans lately. That when we wear the jeans, we know the kind of the fat, unfortunately, hangs off of that area, and the kids have so wonderfully named it the muffin top. But those are the areas that are most popular.
Okay. All right. And what is the effectiveness in those areas?
So if you're an appropriate candidate, and that's where, we'll evaluate you. If you're an appropriate candidate, you can get great results in that area. Okay. So first of all, most people, they come in and they'll say, in fact, a lot of times they don't even know about the muffin top, but they'll say, oh, it's my abdomen, or they don't even say abdomen, it's my stomach or my tummy, it's just big. And for instance, just recently somebody came in and their daughter is getting married, and so we chatted, and she wanted to fit better in her dresses, and I kind of joke and say, all our kids should be getting married or something, because then everybody starts taking better care of themselves.
There you go.
So she started to improve her lifestyle habits, which usually means a healthier lifestyle, and she was beginning to lose some weight, okay, but she knew that she would need some assistance because she had a lot of superficial fat on her abdomen. So we chatted about it, what the benefits of it are, what are the risks, what's the downtime, and so forth, and we elected to do that area for her. Now, when we look at the abdomen, there's a little nuance there that I'm going to try to describe to our listeners who might be driving or at home, is that a lot of times people will grab their skin on their abdomen and say, oh, look at all this fat here. Okay, so when you grab your skin, if there's a lot of fullness between your fingers and your thumb, then you have a fair amount of superficial fat. And we can help you. That's where SmartLipo can help you, because we can put local anesthesia. That's the area between your skin and your muscle of your abdominal wall.
Okay.
And so we can put local anesthesia in there, do the procedure, laser, emulsify the fat, suction out the fat, and we can get a nice reduction of volume in that area. Okay. However, if you grab your front of your abdomen and say, oh, look at all this fat, and your thumb and your fingers are almost touching each other, you're probably talking more about loose skin.
Okay.
And so for those patients, they're probably better served by a tummy tuck.
Okay.
Not so much because of fat, and even if they have a little bit of fat, not so much because of the fat, but because of the looseness of skin. So the best candidates are those who kind of grab the abdomen, and between their forefinger and their thumb, there's some distance. It's not almost touching, but there's some distance. Those are the patients that we can help. And if you have a hard time understanding that, all you have to do is grab back in the muffin top area, because that area usually is very superficial and you can see what's there. The other caveat of that is that sometimes, and I'll just use my analogy. I said, everybody has an Uncle Joe. You used to see him, we're coming to the end of August. We got, 2 more days left. You go home, the family barbecues and all, and Uncle Joe's sitting there with this big belly, right? And you're a little kid, and you think that you can put your finger into Uncle Joe's abdomen and your finger's going to sink into there, right? And then Uncle Joe sort of slaps his belly and goes, look at that. Feel how hard that is. I don't have any fat there, even though it's very rotund. And when you kind of hit your finger against their abdominal wall, it kind of bounces off of it and it doesn't go in very far. So unfortunately for Uncle Joe, that's not a healthy situation. He does not have a lot of superficial fat, but he has deep fat, or what we call visceral fat. That means that's the fat that's inside his abdominal cavity, and we can't do anything for him for that. He has to lose weight, whether it's him through his lifestyle changes or through some medical management or even gastric bypass, okay? He needs to lose weight, because that is the process of trying to diminish the deep fat in his abdomen that's causing that protrusion, the protuberance of his abdomen. So we try to help patients with that. And a lot of times patients also will have a combination. And unfortunately, post-COVID, me being a baby boomer, I put on a little bit of weight here and that I don't like, and I'm working on that myself. And I know that part of that, luckily for me, is superficial, but some of it is deeper. So I know that I do have to bring my weight down as well and make my appropriate healthy lifestyle changes to help to reduce that protuberance, if you will. On the waist, again, put your hands on your hips, or on the back side on the muffin top area, that's all superficial, okay? And that's where actually we can make a huge difference for patients, because I know that superficial fat, I can be really aggressive in the amount of volume that we extract from that area, and it just gives this great slimming result. And in fact, if a patient sort of has a rotund trunk, if you will, and has lost their weight, they feel like they have fat in the front of their abdomen and they have the muffin top, and they said, I can only do one area, or I'm only going to let you do one area, Michelle, I wouldn't do the front.
Really?
I would do the waist, put your hands on the hips again, or that back area. And that makes a huge, huge difference. Of course, I want to do both areas for the patient, okay? But if you limited me, that's where they're going to have a big wow. That made a huge difference. You know, my dress size has gone down, or guys, my waist size has gone down, or I feel more comfortable in my clothes. I don't have that kind of bulging out over my pants or my shorts for the guys or for the women, where they, you know, they feel like they project a healthier image if their waist is narrower. And I'm talking about whether you're a big person, a big animal, or a little animal. And it's interesting that, you know, Michelle, I grew up in the Twiggy era, which I don't think was a very healthy time. You
it
know,
was
that's
pretty thin, yeah.
It was, you know, thin as in was the comment growing back up in the Midwest. And I have to say that since I started doing body sculpture way back in 2007, that it actually made me appreciate even more the larger person, okay? Because it's really not about whether they're a small size or they're a large size. It's about proportion. And that's where I feel that SmartLipo can really help to restore a patient's confidence, because, you know, you feel better about yourself, right? Whether it's new pair of shoes, new hairdo, new clothes, a new tie, it just makes you feel better if you feel like you're projecting this positive image out to the world. And so working on the waist muffin top area gives me great joy as a surgeon in terms of the results. And then, of course, absolutely the abdomen. So my friend who I did this for, whose daughter is getting married, that I mentioned, we just saw her at 2 weeks out, and she was ecstatic. Oh, wow. That might be her calling on the phone.
That might be her
That might call on the phone. So you can tell this is a live show, and that is a live phone call coming in. And that is actually one of the best places to do. You also mentioned, you know, other areas that I had mentioned before, and the chin neck area is also a nice area, but again, it's going to be more for if it's fatty. If it's loose skin, then you're unfortunately going to need a more formal surgical neck lift. Okay. And SmartLipo is not the treatment for those patients.
Understood. I'm so glad that you talked about that muffin top area, because, like, honestly, we look at ourselves in the mirror and we rarely look at what the back looks like. And, like, we're surprised that in pictures, like, what is that? And that you don't really look at yourself from that angle. But I can totally see that getting that slimming and getting that proportions right again, sort of like hourglass for ladies, can just be so nice, right?
And, you know, and it's even for men, doing that area gives them the V back, right? Right. Gives them with a V back that I haven't seen in a while, but that's, you know, that's what I would like to have. And it can really make a difference. And as we evolve and we get older, okay, one of the sort of the natural evolutions is that we want to retain fat, because as we get older, we're kind of saving fat to use for famine and old age and disease. Okay, that's why we have fat on board more as we get older. The problem in the United States and around the world, but a lot in the United States, is we have too much of those fat stores, and so that's where it can hurt us both health-wise as well as cosmetically. And, you know, we kind of have this thing, and as we get older, and I'm getting older, but though we're still, you know, we're still living life like a youngster, and we kind of want to still emote that image. What we can do with SmartLipo is help to restore that for the patient.
Great. So is this something that you could use, say, on thighs or buttocks for like the skin, the little sort of wrinkly skin, your cellulite?
You're referring to cellulite. Okay, well, that's interesting you should ask. So cellulite, unfortunately, is a really tough issue. It is more of a hormonal type of problem.
Got it, okay.
That's why you see it in women and not in men. Sorry, ladies, you gotta bear the kids, and you have to bear with cellulite. And just, I'm going to just tell you as a blanket statement, liposuction does not improve cellulite.
Okay, that's good to know.
I would not offer that to a patient. I feel that, you know, the cosmetic dollar, like everything in the world, is becoming hot, you know, costing more and more, and you really have to prioritize where you're going to get the best bang for your dollar.
All right, that's good to know. Yeah. So let's talk about recovery. You talked about garments that you're wearing. So how does it feel to have SmartLipo, and then what is your recovery like?
Okay, so, you know, having the procedure, very much like going to the dentist, and the poor dentist, we always throw them under the bus. Actually, I always feel like I've succeeded when the patient says, that was easier than going to see the dentist, okay? And we hear that a lot, which is great. Sorry, dentist. But the technique is basically slow slowly injecting local anesthesia. And I learned that from my dentist, okay?
The best dentist I've ever had did it very, very slow. He was a
Exactly.
pediatrician dentist, so
Yes,
he knew
so
what he was doing.
exactly. So the slower you inject it, the more comfortable the patient is.
Right.
So you have to go somewhere where they're not rushed for time, they're taking their time, and it's a slow infusion of the local. So once that's done, you really shouldn't feel anything at all. In fact, it feels surrealistic. You'll know that I'm in there with a laser, or you know I'm in there and we're emulsifying the fat, or you know I'm in there and I'm suctioning the fat, because you can feel motion, but you shouldn't feel any discomfort at all. Okay, so that's the key, is moving slow, moving safely, lots of local anesthesia, and that's the key. So in terms of what does it feel like, most people say, that was actually a piece of cake. The hardest part was just lying on the table, because it takes longer, so you have to be prepared for the fact that it's going to take a little bit longer than under general anesthesia.
Right.
But it makes the recovery so much quicker. So usually patients, when they go home, they don't have any discomfort, because the local anesthesia can last anywhere from 4 to 12 hours on the patient. Local anesthesia actually dissolves, if you will. It's what we call lipophilic. So it actually gets absorbed into the fat cells, and that's where we were working, right?
That's where you wanted it, yeah.
And so that's why you get this prolonged anesthesia. So usually patients are feeling pretty well. They are leaking the fluid out, and so you have to be aware of that. We do have a garment on you, and that garment is to help to contour the body, and that's really important. That's as important as physical therapy after having a hip replacement.
Wow, okay.
Having a garment is really important, and you're going to wear that 24/7 for 2 weeks, okay?
Okay.
You can take it off and shower, you can take it off to go to the bathroom, but you need to wear it 24/7, okay, for 2 weeks. Then, if you can tolerate it, I highly recommend that you wear that garment just during the day for an additional 4 weeks, okay? Because I have personally seen that help to shrink wrap people down, and it does make a difference, okay? So having a good surgical garment, you know, not borrowing your friends, but getting one that's measured for you, that's right just for you, okay, is very important in terms of getting the results. In terms of discomfort, okay, you know, you are going to have some discomfort afterwards. As I said, a lot of times patients, maybe they're beginning to feel a little achiness, and they might take a pain pill that evening. I'm going to say that about half the people can just take acetaminophen, which is Tylenol, and the other half might need a Vicodin or hydrocodone for pain afterwards. Usually, but however, you know, you do well, you go to sleep, and then you wake up in the morning and you have this sigh of relief, like, I know Dr. Tom said it was safe, you know, and they've never had any major problems with this, but I made it, I'm alive, you know, that's how you feel after surgery the next morning. And you say, I feel great. And then you try to get up and you go, whoa, and you say, boy, it feels like I've worked out harder than I've ever worked out. Okay, so it's kind of that kind of achiness. Usually that lasts about a day or two, and most people are doing well. I will say that most people are usually driving in about 5 days' time, 4 or 5 days' time. You know, they're kind of walking around a little more gingerly for the first 24 to 48 hours, but after that, they're up and moving about. And again, everybody, it's patient specific.
Sure.
Michelle, I have some people who are out and running around in 2+ days, where some people takes a little bit longer. But I do know that the local anesthesia technique that we use, along with the laser and SmartLipo, is just a lot better for the patient in terms of their post-op recovery. So that patient who, you know, let's say with traditional, maybe you're down for a week or two, really feeling pretty uncomfortable, that patient who's, you know, that patient might be the one that they're uncomfortable for 4 or 5 days, but they're not uncomfortable for 2 weeks.
Right,
okay?
right.
So it does make a difference for all our patients.
Is there any bruising that goes with the SmartLipo?
So actually there's less bruising.
Okay.
And there's less bruising for a couple of reasons. Is because of the laser. The laser helps to seal blood vessels. As is important is that local tumescent anesthesia technique. So we use such copious amounts of fluid. It has that hydrostatic pressure within the superficial layer of your fat that compresses down, and so it helps to seal blood vessels and helps to minimize blood loss, which is bruising. And then also in that solution, it has adrenaline, or what we call epinephrine medically, as part of that, and that also causes your blood vessels to constrict. So you have less bruising with that. So usually, in most people, I'm going to say 95% of patients or so, they have very minimal bruising.
That's great.
So it's really a nice technique.
Wow, we've learned a lot about SmartLipo, so people can call you for a consultation and see whether they're appropriate for this.
Absolutely. I appreciate you being here, Michelle. Karina couldn't make it today,
Yeah,
but
sure.
you call our surgical liaison, Karina. Just call our office and she'll set up a phone consultation with you with her, then set up a virtual consult if you can send in some photos, and or we can do it in office consultation if that's the patient's preference.
Great. But now's the time, if you're interested in this, to make a call to book in advance, right?
Absolutely. We're already booked up 3 to 4 months in advance. So if you are interested, please give us a call. You know, we do sometimes get cancellation, or I should say postponements of procedures. Life happens, and so times can open up, and so we have a waiting list to kind of move people up if there's availability.
Yeah, but wearing those garments then, when it's colder, it'll be easier to hide those garments, right?
It is, although I have to tell you, I have some people very close to me who wore it during the summer, and they did just fine.
Really?
Yeah.
Oh, great.
So I wouldn't let the time of the year deter you.
Okay.
But if you tend to run hot, then definitely in the winter time's a better time to have the procedure. You're right.
Okay, all right, very good. Well, I'm going to jump over to this
Okay,
microphone
thank you,
here.
Michelle. We appreciate you hosting us here.